This is Dr. Bev Knox, and you are listening to my Psychology Tutorials. Learn psychology while you sleep. People often think of childhood as a carefree and happy time, yet it can also be frightening and upsetting. In fact, children of all cultures typically have at least some emotional and behavioral problems as they encounter new people and new situations. Let us review depression and bipolar disorders in children. 2% of children and 8% of adolescents experience depression. Childhood depression is often characterized by such symptoms as irritability, headaches, stomach pain, and a lack of interest in toys and games. In addition, over the past 2 decades, there has also been an enormous increase in the number of children and adolescents who receive diagnoses of bipolar disorder. Let us review major depressive disorder in more detail. As with anxiety disorders, very young children lack some of the cognitive skills that help produce clinical depression, thus accounting for the relatively low rate of depression among the very young. For example, in order to experience the sense of hopelessness typically found in depressed adults, children must be able to hold expectations about the future. Nevertheless, a life situation or biological predispositions are significant enough. Even very young children sometimes have severe downward turns of mood. Depression in the young may be triggered by negative life events, particularly losses, major changes, rejection, or ongoing abuse. Children depression commonly features symptoms such as irritability, headaches, and stomach aches. Clinical depression is much more common among teenagers than that of younger children. Adolescence is, under the best of circumstances, a difficult and confusing time marked by angst, hormonal, and bodily changes. Interestingly, while there is no difference between the rates of depression in boys and girls before the age of 13, girls are twice as likely as boys to be depressed by the age of 16. For decades, bipolar disorder was thought to be almost exclusively an adult disorder, and that its earliest age of onset is the late teens. However, beginning in the mid-1990s, clinical theorists did an about-face, and a rapidly growing number of them came to believe that many children display bipolar disorder. For example, one review of national diagnostic trends from 1994 found that the number of children and adolescents diagnosed and treated for bipolar disorder in the United States increased 40% from 25 such cases. Based on a range of research findings, the task force of DSM-5 came to the same conclusion that the childhood bipolar label had been over-replified. In an attempt to rectify this, DSM-5 now includes a new category: disruptive mood dysregulation disorder. It is hoped that henceforth, children with severe anger and temper outbursts will receive this diagnosis, and that the number of childhood bipolar disorder diagnoses will decrease. It is also hoped that the inclusion of this new category in the DSM-5 will help clinicians clarify whether certain young adolescents do, in fact, suffer from the early stages of bipolar disorder. Although a number of psychological approaches seem to be helpful for children with a diagnosis of bipolar disorder, fully half of those in treatment receive an antipsychotic drug. A third receive an anti-bipolar drug, and many others receive antidepressant or stimulant drugs. Yet, relatively few of these drugs or drug combinations have been tested for such use with children.